Hi, good evening. So today we'll be reading the osteology, right? So we'll be reading about various bones associated with the head and neck region, the various muscles, attachments, nerve supplies, arterial supplies, venous drainage, and other associated topics. Okay. So this is the front of the skull, right? Or the skull and face. In this picture, it is a very clear picture. So let's first understand the basic bones which are visible in this particular view. Then we'll see different views of the skull. And then after that, we'll see what all various foraminas are there and what all structures are passing through them, right? In this particular picture, we can see various fissures, various foramen, various apertures, various bones. Let's start with this, the first bone, which is known as the frontal bone. And this is the squamous part of the frontal bone. So this structure, the front one, is the frontal bone. The second structure is known as the frontonasal suture. So this one is the nasal bone. This one is a frontal bone. Between the frontal and the nasal bone, there's a suture. This suture is known as the frontonasal suture. Next is the frontomaxillary suture. So if you see, this is the frontal bone, right? And this is the maxilla. So this is the maxilla, this wheatish color. Okay. So the maxilla and the frontal, there is a suture here, which is known as frontomaxillary suture. Then there is a foramen, which is known as supraorbital foramen. Now, very important thing to understand here, that there are three foramens which are almost in one straight line. The first one is supraorbital. The second one is infraorbital foramen. And third one is the mental foramen. So if I draw a line, it will pass almost straight and they are all in one line. That is supraorbital, infraorbital, and mental foramen. Okay. So let me just delete this line so that it doesn't hinder in the further understanding.
Undo option must be there.
Yeah, it's done. Here. Now let's go to pen again. Okay, now next is the sphenoparietal suture. Now, in the upper view of the skull, let's see first the parietal bone, because from here it is not very evident. Here, if you see, this is the frontal bone. These are the parietal, and this is the occipital bone. Okay. So, if you see this brown structure, this brownish color, this is the parietal. And if you see, the sphenoparietal sutures is between the sphenoid bone and the parietal bone. So there is a little bit of sphenoid bone, which you can see from here. It's a little greenish color. So here you can see, this is the sphenoid bone, right? This is the greater wing of the sphenoid. This is the lesser wing of the sphenoid. And a part of this, which is obscured by this bone, this is the sphenoid bone. So this suture is called as the sphenoparietal suture between the sphenoid bone and the parietal bone. Okay. Next is the frontozygomatic suture. So this is the zygomatic bone. Okay. And so obviously this is the frontal bone. So now in any of the bones, when you see various extensions, like this is a kind of extension which is going this side, this is an extension which is going towards this side. So we name according to the extension where they're going, right? So this is known as the frontozygomatic zygomatic suture, right? So between the frontal bone, the zygomatic process, and the zygomatic bone, which is the frontal process. So the suture between these two bones is known as the frontozygomatic suture. Now, this is the temporal bone, right? So if you see the lateral view here, this is again the parietal bone, frontal bone, sphenoid bone, and this is the squamous part of the temporal bone. This is the reason, why the different views of the skull are important, because there are some bones which we see in the lateral view, some bones in the front view, superior view, interior of the cranium. So different bones are visible, and we understand them very nicely in different views. Okay. So this is the temporal bone, right? Now, next, if you see here, this is known as sphenozygomatic suture. So this suture is it between the sphenoid, that is greater wing of the sphenoid, and again, this is a zygomatic bone. So this suture is known as sphenozygomatic suture. Next is the lacrimal bone. Now, if you see here, like I'll change the color. Use yellow. Okay, so here is the lacrimal bone. Okay, so this is the lacrimal bone on this side. Okay. Next is the nasomaxillary suture. Okay, so this is the nasal bone and this is the maxilla, the wheatish color. So this is the nasomaxillary suture. Now we are just learning all these sutures, the bones, because they are very, very important, and it gives a better understanding what we have to learn in the future, right? So these sutures are also very important. Next is the infraorbital foramen. Right now, we'll just learn where they are located, and then we'll learn which structures passes through them, and I will test your knowledge after that. Okay. Now, this one is the infraorbital foramen, which we saw that 3 foramens are lying in the one straight line. Okay. Right? The supraorbital, infraorbital, and the mental foramen. Okay. Then we have the middle nasal concha. Okay. So these are the various conchae, right? This is the middle nasal concha. This is the inferior nasal concha. And this is again, obviously, this is the mandible. So this is the ramus of the mandible. So let's see if we have a picture of mandible. Yeah. So in this picture, you can see this is the ramus, this is the condylar process, and this is the coronoid process. Okay. So we saw the ramus of the mandible. Then next we have the intermaxillary suture. So this is the intermaxillary suture. Now here there is a structure which is known as anterior nasal spine. Now this structure is also very important, and we'll see the importance of this structure in a little while. Okay. This is again a mental foramen. This is the body of the mandible. So this is the ramus body. Okay. Now these are the maxilla or the alveolar processes. So these are the various alveolar processes of the maxilla. As I told you that every bone has various extensions, and the name of that extension is known as process. So wherever it is going, it is known as that process. So this is entire is maxilla. These are the alveolar processes of the maxilla. Okay. Now this is very important. The nasal septum, the bony nasal septum is formed of 2 bones. One is ethmoid and the other one is vomer. Now, if you see, the upper is ethmoid and the lower is vomer. Let's see ethmoid in a different view as well. Yeah, here. So if you see, this is the interior of the cranium and this is the ethmoid bone. Now, this ethmoid bone is associated with crista galli. There are a lot of sieve-like structures which is known as the cribriform plate of the ethmoid, like a chunni. So there are a lot of sieve-like structures which are located here. We'll understand the various why there are so many sieves or so many cribriform plate, because there are a lot of extensions which are passing of a nerve. Okay, we'll see which nerve and how they are passing in detail. Okay, now we have the zygomatico-maxillary suture. Now this is the maxillary. So this is the zygomatic process of the maxilla. This is zygomatic maxillary process. So zygomatico-maxillary suture. Infraorbital margin is this margin. Then we have the inferior orbital fissure. Now these two structures are very, very important. The below one is known as the inferior orbital fissure, and the upper one is known as the superior orbital fissure. There are a lot of structures passing through the superior orbital fissure as well as the inferior orbital fissure, which we'll be reading in detail. Now, as we all know, this is the zygomatic bone, the brown one. Now, this one is the greater wing of the sphenoid, and this one is the lesser wing of the sphenoid. Okay. Then we have the superior orbital fissure. Frontal bone, we have the zygomatic process. So this is the frontal bone. This process going towards the zygomatic bone is known as the zygomatic process. Okay. Then we have the supraorbital margin, coronal suture seen from the side. Let's see from the upper side. This is known as the coronal suture. So this suture is known as the coronal suture. This suture is known as the sagittal suture. This suture is known as the lambdoid suture. The junction of coronal and sagittal suture is known as, anybody? Neha. Neha, are you there?
Yep. Bregma, as it is written.
Yeah, it's bregma. Very good. So this is known as bregma. What is the junction of lambdoid and sagittal suture known as? Anybody? Neha?
Let me just recall.
Lambda.
No.
Okay. Okay. Now these are the two parietal foramina. Okay. This is the parietal eminence. We'll read all these structures in detail. Don't worry. Okay. Now let's complete the front, the bones. Now this is the parietal bone sphenoid angle. So we know that this is the parietal bone, which we saw in the ventral view. Then this is the sphenofrontal suture. We have already seen. So the sphenofrontal suture, right? So this is the frontal bone and the sphenoid bone. The suture between the frontal and the sphenoid bone is sphenofrontal suture. Maxilla, we have the frontal process. So this maxilla has a frontal process going towards the frontal bone. So this is the frontal process of the maxilla. This is zygomatic process of the maxilla. And can you tell me what is this process known as? Neha?
Alveolar process.
Yeah, very good. They are the alveolar processes of the maxilla. So zygomatic process, frontal process, and alveolar process of the maxilla. Very nice. Then we have the fronto-lacrimal suture. Now I have put a lot of drawings here. So this is a frontal bone. This is lacrimal bone. Between them is the fronto-lacrimal suture. Then internasal suture, right? Between the nasal bone. Now, these are all structures which you can see in the front view. Okay. Now let's go to the, before that, let's test your memory. Okay. You want to see once more before I test your memory, or that's completely fine? You want to see once more? Neha, Aman?
That's fine.
Fine. Neha?
Yeah, that's fine.
Sure?
Yeah.
Okay. My first question. Can you name this upper bone?
Ethmoid.
Very good. This is ethmoid bone. Can you name this lower bone?
Vomer.
Vomer. Together they form the
Nasal septum.
nasal septum. Very good. This foramen.
Supraorbital.
This foramen.
Infraorbital.
This foramen.
Mental foramen.
Okay. This fissure.
Superior orbital.
This one.
Inferior orbital.
Very good. Okay. Can you tell me suture here? Which suture?
Frontozygomatic.
Frontal.
Frontozygomatic. Very nice. Very nice. Okay. What are these processes called?
Alveolar processes.
What is this structure of the mandible?
Ramus of
Ramus.
mandible.
Very nice. Good job. So this is the which bone?
Former part of the frontal
Ramus part
bone.
of frontal.
Very nice. Very nice. So now we know all the structures which are seen on the front view. Okay. Now we are going to see the lateral view of the skull. Now, to understand lateral view, it will be much more easier as compared to the frontal view, because now we know a lot of bones which we have already seen in the frontal view. So we don't have to again, understand them. On the lateral view, if we see, this is the parietal bone, frontal bone, temporal bone, sphenoid bone, right? This is the coronoid process. This is the condylar process. Now let's see from here if we miss anything. Okay. So mandible angle, we know this is the angle of the mandible. Okay. Mandible, we have the coronoid process, which is obscured by which two bones? Can you tell me? What is the name of this bone? Anyone?
Zygomatic part of temporal bone.
Very nice. Because this is a temporal bone and this is the extension. So this is the zygomatic process of the temporal bone, because this is going towards the zygomatic bone. And this one is zygomatic bone, right? Temporal process of the zygomatic bone. And this suture is known as temporozygomatic suture. So if you see here, this suture is known as temporozygomatic suture. Okay. Now, this is a very important structure, which is the styloid process. This is the occipital condyle. So this is the occipital condyle and this is the styloid process. This is the mastoid process. Okay. Now this is the occipital bone. This is the mastoid process of the temporal bone. Now this is known as the occipitomastoid suture. This is known as the parieto-mastoid suture. This is the lambdoid suture. Okay. So parieto-mastoid, occipitomastoid, lambdoid, squamous suture, inferior temporal line, superior temporal line. We know that squamous suture. This is the squamous suture. Then we have the coronal suture. So we saw the coronal suture here as well. This is the coronal suture. Okay. Then we have the sphenofrontal suture, spheno-squamous suture, frontal bone squamous part, we all know, temporal line, sphenozygomatic suture. So this is the spheno and the zygomatic bone. So sphenozygomatic suture, frontozygomatic suture. So this is the frontal bone and this is the zygomatic bone. So frontozygomatic suture. Ethmoid. So we know that the cribriform structure of the ethmoid bone. Frontolacrimal suture, we all know, lacrimomaxillary suture. Nasal bone, we have already understood. Anterior nasal spine, which I already told you. Zygomaticomaxillary suture. Okay. Which this is the mandible body, this is the mental foramen, and this is the mental protuberance. Okay. Something which is going out, like protruding. Okay. So this is the mental protuberance. Okay. Now, there are some structures which are very, very important to understand. Now, we come to the question part. Okay. The lot of questions which are asked. The first question which is asked is about the vertex. So we'll read about what is vertex. We'll read about bregma. We'll read about lambda. We'll read about obelion. We'll read about pterion and we'll read about asterion. Okay. Now let's first read about the vertex. It is highest point on the sagittal suture. So if I show you the sagittal suture, so this is the sagittal suture. So let me show you here. This is the sagittal suture. So the highest point of the sagittal suture right? The highest point of the sagittal suture is known as vertex. Okay. Second is the bregma. As I told you, bregma is the junction of, it's not here, it will be here. This is the bregma. Bregma is the junction of coronal and sagittal suture. Next is the lambda. Lambda is the junction between the sagittal suture and the
Lamboidal.
lambdoid suture. So
Lamboid.
this is the lambda. Okay. What is inion? Inion is the highest point on this occipital bone, right? So the highest point is known as the inion. Okay. Next is the obilion. Obilion is the point where between the two parietals. So you see the two parietal foramen. This point is known as the obilion. Okay. What was the name of this point? The highest point on the sagittal suture. Anyone?
What?
Very good. Vertex.
Vertex.
Inion is on the occipital bone.
Occipital bone.
So this is the obilion. This is the vertex. This is the bregma. This is the lambda. So obilion, vertex, lambda, bregma, and inion. Okay. These are easy to understand.
Yep.
Now the question is asked for pterion and asterion. Okay. Now pterion is an H-shaped. Where is it? Yeah, it is H-shaped suture, and it has 4 bones: the frontal, parietal, temporal, and sphenoid. Let's see where we can see it clearly. Okay. So here it says frontal bone, parietal bone, sphenoid bone, and temporal bone. When these all 4 bones are joining, this is a H-shaped structure, which is known as the, anybody?
Pterion.
Pterion. So what all 4 bones are associated with pterion? Frontal,
parietal, sphenoid, temporal.
Yes. So if you see frontal, parietal, temporal, and sphenoid, it joins to form a H-shaped structure, which is known as pterion. The anterior branch of middle meningeal artery, middle meningeal vein, and lateral sulcus lie deep to the pterion. So middle meningeal artery is very important in this structure. Okay. Next is the asterion. Asterion is the meeting point of parietomastoid, occipitomastoid, and lambdoid. So let's see where are these sutures. First is the lambdoid suture. It's my pen. Yeah, it's here. First is the lambdoid suture. Okay. We have the parietomastoid suture. Okay. So this one is the parietomastoid suture. This one is the, so this is the occipital bone. This is the mastoid, right? So this is the occipitomastoid, right? This is the parietal bone. So this is the parietomastoid. Okay. So parietomastoid, occipitomastoid, and this is the lambdoid. Okay. So this structure is known as asterion. Asterion. So asterion is the junction of parietomastoid, occipitomastoid, and lambdoid suture. Okay. So can you repeat it, Neha?
Yes. Asterion.
Yes. What is asterion?
Asterion is the junction of parietomastoid, occipitomastoid, and lambdoid sutures.
And lambdoid suture.
Lambdoid suture, yeah.
Very nice. So let's see this structure on the skull. Now, if you see, now what happens is that was a colored picture, right? But in the exam, it's not always that they give you any colored picture, right? Most of the times they give us a picture of the skull, right? So we should know where is asteroid, okay? Or asterion, okay? Now, if you see, this is the lambdoid. This is, always remember that this is the mastoid bone. This is the occipital, right? So occipitomastoid, right? parieto-mastoid. This is a parietal, right? Parieto-mastoid and lambdoid. So this structure is known as asterion. This structure is known as
Asterion.
asterion. Now, if we identify pterion here, this structure is known as
Pterion.
pterion. Pterion is formed by 4 bones. Can you tell me?
Frontal, parietal, temporal, and sphenoid.
Very good. Greater wing of the sphenoid or the sphenoid. Okay. So this sphenoid, temporal, parietal, and frontal. 4 bones forming pterion. Middle meningeal artery, middle meningeal vein 1. Okay. Then we have the asterion. Okay. So the junction of lambdoid, parieto-mastoid, and occipito-mastoid sutures. In the newborn skull, the mastoid fontanelle are in this region. Okay. So we have to remember that in the newborn skull, the mastoid fontanelle are in this region. Right. So we can also write here mastoid fontanelle are in this region. Pterion we have already understood. Right. Now, what is the function of pterion? What is the importance of pterion? If you see, it is an important landmark since it overlies the anterior branch of the middle meningeal artery, which is very, very important. Why? Because it may be ruptured by the blows on the side of the head, giving rise to extradural hemorrhage. Okay. So it can give rise to, if there is an injury here on the side of the skull, there can be extradural hemorrhage. There can be extradural hemorrhage, right? Now, also in the newborn skull, the sphenoidal fontanelle are in this region. So if you see in the region of pterion, we have which fontanelle? Sphenoidal fontanelle. Okay, so we have learned many things related to pterion, asterion. Okay, because they are very, very important. Which all bones are associated with pterion? Which all bones are associated with asterion? And which fontanelle is associated with pterion and which fontanelle is associated with asterion? Okay. So here the basic structures are ending. I'm just making this video till here, and then we'll make the next video. Okay, so in this video, we have understood the basics of the basic structures of the skull, face, the bones, and the structures which are located.